Well, while we're talking about the anterior cruciate ligament, let's talk about some of the pitfalls of diagnosing anterior cruciate ligament tears. These are some of the things that can mimic an intrinsic anterior cruciate ligament injury: ACL ganglion or synovial cysts, myxoid degeneration, and anterior meniscofemoral ligament. In this case, on a sagittal T1 weighted image, we're seeing expansion of the anterior cruciate ligament, and on the T2 FACR image, or PD FACR image, there is a focal fluid component. The ACL is intrinsically intact, and you would expect it to be functionally stable, and it was in this case, but this is an incidental ganglion cyst. Sometimes these can produce mechanical limitation of joint movement, but very often it's just an incidental finding and shouldn't be confused with an ACL tear, which has obviously much more ominous implication.
In the analysis of medial supporting structures of the knee, there are two particular techniques that have been used. The first of these relates to layers of tissue on the medial side of the knee, and it's shown very nicely here in drawings taken or done by Michael Stadnick in the RAD clinics. And basically, as you look at this, you can appreciate that there are three layers, starting superficial to deep: fascia, superficial medial collateral ligament, and then some deep structures, including the deep MCL and capsule. Now, this sort of analysis utilizing tissues, layers of tissue, is helpful, I think, particularly through dissection, but we run into problems in imaging because, in fact, these layers may fuse. For example, fusion of layers 1 and 2 occurs anteriorly, and fusion of layers 2 and 3 occurs posteriorly. And this, therefore, creates some diagnostic difficulty on analysis of MRI.
So first, when I'm looking at a knee MRI, I look at the axial images first. You see this on the right here. And I like to look at the joint fluid. And the joint fluid will give me an idea of how much is going on there in the joint. And this I would call moderate joint effusion. It's very subjective. But the thing I look for, I try to window the joint fluid so that I can see inside it. And when I window the joint fluid here, I can see inside it we have this synovial proliferation. So that indicates to me that there's either an inflammatory arthropathy there, or that there is some kind of chronic internal derangement leading to synovial proliferation. The extent of this doesn't really look to me like it's rheumatoid arthritis or anything like that. It looks to me like they've had chronic internal derangement. Then I like to look around the joint and see if there's any fluid collections around the joint, ganglion cysts, things like that. We see some prepatellar edema, which we'll talk about later.